The truth comes from people honestly engaging with the data. Censorship kills that. Censorship kills science. And I think censorship actually killed people during this pandemic.
Censorship killed people. It's a powerful statement, isn't it? Joining me now, Dr. J. Bhattacharya, professor, Stanford School of Medicine, also author of the book, The Great Barrington Declaration, which we're going to get to in a minute. Doctor, thank you again for joining us. Please tell me, how did censorship kill people?
The key thing is, Jesse, is that science is messy. It requires different people talking to each other, disagreeing with each other, coming up with experiments to determine what the truth is. It takes time, and it takes courage. Like, you have to speak up when almost everybody else thinks one way. Some scientist comes along and says, no, that's not right, and then it turns out to be right. Censorship killed people by locking in place bad ideas during the pandemic. Ideas like there's no immunity after COVID recovery. Ideas like it's impossible to treat the disease at all. Ideas like the vaccine has no side effects at all. Ideas like it's vaccine mandates are the only way to get to herd immunity. Ideas like herd immunity is only possible through a vaccine. Each and every one of these ideas did harm. Ideas like we shouldn't be talking about the economic harms from the lockdowns because they're not important, even though it destroyed the lives of poor people around the world. Ideas like, it's okay to keep kids out of school. That won't harm them, even though it'll shorten their lives, lead them to less healthy lives as a consequence of keeping kids out of school. These ideas all should have been debated up front. And instead, we had this censorship regime that just suppressed scientific discussion around this and led to just incredibly one of the worst public health policy in my lifetime.
Doctor, can you help me understand, because I'm obviously I have no business in that heady world of yours. I'm with the dumb people over here. Can you help me understand why so many people in that community, high IQ people, did go along lockstep with each other? It doesn't make sense to me, because apparently I'm naive. I picture this, gigantic room full of geniuses, everyone trying to work things out and figure things out. And instead, what I saw was only a few of you trying to do that, and the rest are a bunch of lemmings. How does that happen?
Jesse, can I just say, you're not one of the dumb guys. Frankly, you had better intuition than most epidemiologists that spoke up. And also, the other thing I'd say about this is that I was naive in the same way as you before the pandemic. I actually thought that we could have a honest scientific discussion. What I saw during the pandemic was that top scientific bureaucrats, people like Tony Fauci, who control the budgets of the NIH is $45 billion. Every single school in the country, medical school in the country of note, gets a tremendous amount of money from it. But what people don't know is that he also controls the reputations and promotions of scientists. I work at Stanford School of Medicine. I'm a full professor here, right? I don't get tenure unless I have an NIH grant. It's because I've been successful with NIH grants that I get tenure. When Tony Fauci steps into health policy, says, the Great Barrington Declaration is nonsense. We should emulate the Chinese lockdown policy. It's very difficult for scientists to speak up, because their livelihoods are at stake. They say, well, if I speak up on this topic that opposes Tony Fauci, I might lose my reputation. Why get involved with that? So I'll just stay quiet. And then there's the people who they try to seek favor with the king. So you're fighting in the court, like the high court, to seek favor with the king. You speak up and attack other scientists who criticize Tony Fauci's ideas. It's this kind of regime, this quiet censorship that doesn't get a lot of attention, but really was the key to the answer to your question, why scientists didn't speak up.
Doctor, if Dr. Fauci has that much power in this country, has it always been that way, where this one bureaucrat controls this huge amount of money and he can buy the opinions he wants? Is this something new? Because this is not anything I've ever heard of before COVID.
I think that power existed. It just became abundantly clear during COVID. Someone like Tony Fauci is kind of is in some ways unique. 38 years ahead of this massive pile of money, controlling what countless biomedical scientists think and say. That's, I think, has been true for a very, very long time. And he's unique in the sense of 38 years. He knows the Washington inside like nobody else. His particular genius is bureaucratic infighting inside of Washington. Why, you ask yourself, Jesse, why didn't the CDC director play a key role in setting COVID policy in 2020? Shouldn't the CDC director, Robert Redfield, have been the key player in this? No, it fell to someone in the NIH who's they're only supposed to do is fund research, not set health policy. Tony Fauci and Francis Collins, who was his boss at the NIH, essentially staged a soft coup, taking over COVID policy when they should not ever have been anywhere near the reins of power. I mean, I thought of him when I first saw him give that famous press conference with President Trump in March of 2020. I thought to myself, we no longer have an elected president. We have, in effect, the real president is Tony Fauci setting domestic policy. I've thought that for at least 2 years after that. He effectively ruined 2 presidencies.
Subscribe to The First TV today for instant access to exclusive specials and content you actually want to watch. Your support helps The First TV fuel the fight against those seeking to destroy our right to free speech. Simply visit thefirsttv.com/support to join the fight today.